Easily find, book, and manage your travel nursing assignments with the AMN Passport app. Download today. I'm sure that it's different. I'm sure that what other ways do you feel like nursing school now has changed since we went 15,
So, as
12?
far as like clinical aspect goes, do you
Mhm.
remember us having to go to the hospital like the day before our actual clinical
Yeah.
and pick our patients?
Yeah.
So, I'm not sure if it's no longer allowed or if my program just doesn't implement that.
Sure.
But they're not doing that. So
Hmm.
they show up to clinical, and that's the first that they've heard of their patient. Maybe they don't know what their diagnosis means, and then they're spending like a lot of time looking things up in clinical that you and I in our class had to look up
Do
before getting there.
before. Oh.
So, I mean, it
Hmm.
has its pros and cons because, I mean, that time that it took to drive to wherever we had to drive to, because we had to drive long ways for clinical.
Yeah.
So that time to
50
go the
plus
day
miles.
before and the day of, so they're not wasting that time. Um, and then they have a lot of stuff to do at clinical because they have all this new information that they're looking up and all their care plans that they're developing and everything like that right on the
Yeah.
spot. And I think
Mm.
that's more realistic to what nursing actually is because you
Yeah,
don't go
that's
in
a
the
good
day before
point.
and look your patients up, right?
Right. Yeah. You don't like get prepared for the day before. That's
Right.
very true. But like how has care plans changed? Have they changed at all or are they the same long document?
So I think if I remember correctly, we had to do care plans for like every patient.
Yeah, you had to do them for every page. I just remember the meds. I remember having to Jane Doe that was like 89 had 20 different meds and you had to look up what they are for. And I don't even remember all the things that you had to look up, but I remember just going through and being like, my lady has 20 meds.
Yes.
Like, I got a lot of work to do.
And we would kind of pick our patients based on the least amount of meds because that
Yeah.
was the least amount of work. As bad as that sounds, but that was like, because
Yeah.
we went to pick them out that afternoon and then we had until the following morning to develop the care plan and turn it in.
Yeah.
And it was like a long document.
Yeah. It was so
So
long.
yeah, but at least the way that my program does it, we only have like one or two care plans due a semester.
Oh.
So
Instead of, well, what did we used to do? Now I can't remember. Was it before every clinical?
I think it was each week for each patient,
Yeah.
we had to turn
Right.
something in. And then like our
Hmm.
evaluation portion of the care plan, like evaluating if our interventions worked, that
Yeah.
we would kind of do a follow up in our journals or something like that. But this one, yeah, they just have, I mean, my sophomores only have one graded care plan this semester. So good for that as far as like a workload.
Yeah.
But I feel like we were prepared when we went to clinical. We knew our patient, we knew their meds, we
Yeah.
knew what interventions we already wanted to implement, and
Yeah.
we kind of had like our plan set for the day. Whereas here, they're more thinking on their toes, which I think is
Hmm.
good for more senior level nursing students. But as
Sure.
sophomores or as first semester nursing students, I think it's tough to just walk in
Yeah.
and be like, oh, this is what I'm going to do. This is how I'm going to do it and go and do it. So,
Yeah. Well, I feel like that kind of tracks as I've talked to a couple other nursing professors recently, and they've talked about kind of moving away from some of the, all of the book work, I guess, or like trying to kind of like revamp nursing education to make it more, manageable or kind of hands on and I guess, yeah, like as you go kind of thinking as opposed to just doing, work to do work.
yes. And
Yeah.
I'm not against not having a care plan every week. I mean, I just remember the struggle and the stress that that put on us because we were in the library until midnight and then we had to wake up at
Yeah.
5 and go to clinical, and that's not healthy for anybody.